After every consultation, the work doesn't stop. There's a note to write, a code to assign, and patients who will message after hours with questions their visit should have already answered. Dawn Health closes all these three loops from one single touchpoint, the recording button. All the physician has to do to hit these three workflows is hit the recording button. Then, what they have to do is talk with the patient as they normally would, take their history, listen to their complaints, and consult them without having to worry about writing down their notes or looking at the screen while they're doing that. Then, once they're done, they hit the stop button, select the patient they were talking to, and select a template which they can customize so that the note appears as they would write it themselves. Then they hit the generate button, and in less than 2 minutes, they will have a ready note which looks like they wrote it themselves. Let's take this note, for example, which was generated in a SOAP template. You can see the sections. They're filled according to what was discussed in the visit, and any edits can be made either manually or via voice. And for that same note on the other screen, you can find the ICD-10 code recommendations for this specific visit, along with the E&M billing recommendation with the justification. And finally, you'll find the patient summary, which you can send to the patient via WhatsApp or iMessage or whatever messaging platform you prefer, which has an overview and description of what was discussed with that patient, along with a clear set of instructions that were discussed with them as well on what to do next. And that's how one recording gives a complete clinical note, accurate billing and coding recommendations, and a patient who actually understands their care. Book your demo now with Dawn Health.